Repellency is an interesting term. What it means in its simplest form is causes an agent to move away from a treated animal or surface. So if you had a repellent on you and there were mosquitoes all in this room, they would move away from you. There would be this zone around you where there wouldn't be mosquitoes. Well, there wouldn't be nearly as many mosquitoes as there could be. And so they can act in two ways. They can be sort of volatile, or they can act when the agent or the bug contacts you. In the case of ticks, the repellent on the skin, the tick climbs on and smells it. It's got two little noses in its front legs, and it smells it and says, I don't want to be on this animal, and it'll back off. But a repellent acts differently on a mosquito. So it approaches you, and that repellent attaches to little receptors on their antennae, so it sort of blinds them. It's like putting a blindfold on them so they can't find you. I don't like mosquitoes. I like to study mosquitoes. And the reason I like to study mosquitoes is because mosquitoes are important as transmitters of disease, as causes of irritation to both pets and humans. We raise thousands of mosquitoes in 2 laboratories every week with the intent of understanding more about how they work, how they feed, what happens when they ingest infectious agents. We can then use what we get out of mosquitoes to study the infectious agent. We can infect other animals and study the disease. So mosquitoes are fascinating creatures. We don't like them, we like to study them. In developing countries, now in North America and Eurasia, ticks can rival mosquitoes, but in most parts of the world, mosquitoes transmit more dread diseases than any other bug. It's because of the diversity of species, the numbers of mosquitoes that there are, and the fact that they've adapted to their abilities to develop in dozens and dozens of different environments. We could talk for 10 minutes about the different places you can find mosquitoes. People always laugh at me. They say, just come out in my backyard. I have an old tire. You can get all the mosquitoes you need out of it. So there's some that breed in old tires, temporary water. Some breed in tree holes. Some don't even develop until water reaches a level that the eggs then sort of rejuvenate and hatch. They're remarkable creatures. They've adapted all over the world in just virtually every habitat. So, and they're flying insects, which means that they're highly mobile, so they can go from place to place, much more quickly and faster than a tick can or a flea can or certain other pests. So I'll say it again, we don't like them, but we have to appreciate them as scientists because they're very challenging, not only from the aspect of disease transmission, but from the aspect of sheer numbers, adaptation, diseases they carry. Vector-borne disease is any disease that's transmitted by a vector. Now that might seem simple, but the term vector can be any number of things. It can be an insect carrying agent. It can be some fomite. Fomite is a non-living thing that vectors a parasite from soil to a host. So a vector-borne disease, in its strictest sense, and most of the time is used to define an agent that's transmitted, usually by a bug, I'm using that term in a broad sense, from one animal to another. One thing about mosquitoes is pet owners know mosquitoes. Pet owners know fleas, they know ticks, they know mosquitoes too. If we can encourage them to focus on trying to control mosquitoes as much as they try to control fleas and ticks, then we'd be a step further along the way to providing this multimodal therapy that I think is the way of the future. It's using multiple strategies to control a parasite. It increases your chances. It's like putting good tires on your car, keeping your car in good running, wearing a good seat belt all the time. You're ensuring the likelihood that your trip will be a safe one because you're adding all of these factors that increase safety.